name is Katherine Massey, and I'm doing my informative speech over Staphylococcus aureus and Staphylococcus epidermidis. Some general background over Staphylococcus is most people refer to it as staph, but the whole word is Staphylococcus. If you look at it under a microscope, you can see that it is like clustered grapes, little small balls, and they're just all packed together. The bacteria attacks groups of tissue throughout the body. Most of the time it doesn't get severe, so people don't really have to have medicines or antibiotics, but if it does come severe, it can be potential fatal, or people can actually go into anaphylactic shock because of all the toxins in their body at one time. It is gram-positive, which means it just releases exotoxins. It is facultative anaerobe, which means it can live in oxygen, or it doesn't have to live in oxygen, but it prefers to live in oxygen. It is encapsulated. Now, bacteria that do have capsules, it just means that they are surrounded by a camouflage coat that protects them from being destroyed. Now, when they do have capsules, our body sees them as just part of our body. They don't recognize it as foreign or dangerous or anything like that. But these are encapsulated, so it's a good thing. And there are over 30 different types of staph. The first one is Staphylococcus aureus. Now, this is one of the most important bacteria that causes diseases in humans today. It affects the skin and soft tissues. Some of the things it causes is abscess, which is just pus filled. It's red around it, causes lesions and swelling up under the sore, and it's very painful. Another thing is cellulitis, which is pretty much the same symptoms, but it happens from a cut or a scrape, and that's how the bacteria gets in it. Now, if it does get past the skin, it comes into the bloodstream, and you can get bloodstream infections. You can even get pneumonia and joint and bone infections. Many heal on their own, like I said, but if it becomes severe to that point, some things they have to do is drain the stuff out of it, and antibiotics are required. So it's not a easy thing to go through. Ways that it's transmitted is through infected hands. That's why it is so important to wash your hands very frequently, so it's not transmitted that way. Also through the mucous membranes, which is your eyes, your mouth, saliva, anything wet-like. The result of a severe case of Staphylococcus aureus is it leaves scars and can even damage the skin. Now, the other one is Staphylococcus epidermidis. It is also gram-positive. It is facultative anaerobe, and it is part of our normal flora, which is our own body's bacteria that fights other harmful bacteria. It is also an opportunistic pathogen, and this affects people with compromised immune system, meaning if they stay sick because they have HIV or their white blood cells just stay low, they just are always sick. It even affects drug users, newborns because their body isn't fully developed, the elderly, which they stay sick a lot too, and people in hospitals. Now, the thing with hospital patients is if they are using catheters or applications, that is one way it can transmit as well. If this happens, it can cause severe inflammation and painful urination. Another thing it causes is septicemia. Now, septicemia is toxins in the blood, and you have blood all over your body, so septicemia, if you can go into shock because of it. It also causes the endocarditis disease, and this disease, it's infections in your heart valves and the inner muscles of your heart. Also, Staphylococcus epidermidis, it mostly likes to live on environmental services and patient equipment, like in the hospitals. It is protected by a biofilm, not a capsule, but a biofilm, which is similar, and this protects it from antibodies and our own host defenses, which is the white blood cells and things like that. And because it is part of our normal flora, it has developed high resistance to many common antibiotics. And that is my informative speech over Staphylococcus aureus and Staphylococcus epidermidis.